Okay, hi everybody, this is Dr. Ed Park. Today we're going to be discussing repeat treatments. The opening slide reminds us that the genie tells us we only have 3 wishes and we can't wish for more wishes. Well, I think the reason why people do so many repeat injections or so many people do them is because they get multiple genie. As a way of disclaimer, do your own due diligence. Use of exosomes, of course, has not been approved by the FDA for prevention or treatment of disease. This video is for educational purposes only. It is not an advertisement for exosomes. And anecdotes are not to be construed as scientific proof. Patients were treated in the context of a fully informed patient-physician relationship. But of course, when a person does their own due diligence, they take a chance and they get results. That's when they start thinking about repeat injection. Goals of the talk will be to just recap briefly what are exosomes, what's the therapeutic index, which is a very important concept in medicine, how long do exosomes last, and why do so many people choose to have those repeat injections. So just to remind you, exosomes are not cells. They are about 100 nanometers size, same size as coronavirus, and the same kind of mechanism. It's a phospholipid bilayer, a sphere about like a butter sphere, and in that bubble, it's able to mate or match with other cell membranes and inject its contents. As a result, they go everywhere, although it's better, I think, in my opinion, to start them where they're needed. They are not cells, they don't reproduce, they're so small, they don't have their own machinery, their nuclei, the mitochondria, endoplasmic reticulum. So they're just messages sent out. And they do have these 3 antigens, CD63, 9, and 81, which are helped to identify and make sure we have exosomes. But they don't have the self antigens, those histocompatibility antigens that tell the other cells whether they're friendly or not friendly. Therefore, they can be used by everyone. This is on above me, Duncan Ross. He is a PhD immunologist, and he's been culturing cells for about 8 years, I think. And his lab I visited twice in Florida. It's been FDA inspected. It's one of the few that didn't get a letter in the recent round of warnings on exosome producers. And they have 3 INDs with the FDA going for clinical trials. They employ 40 people with 5 PhDs, and a lot of those have experience with getting products through the FDA. Duncan took 50 injections at once, 50 times 5 is 250 billion. He also has been treated by me 7 times for different reasons. And he gets them very frequently because they're essentially write off and a low cost for him. So probably every month he's doing 5 or 10 billion. No untoward effects. He doesn't have any extra growths or cancers that we know of. And of course, in my practice, as we'll review, there have been no serious untoward effects either, which is huge. When you talk about how many exosomes are there, we have about 7 trillion cells and maybe an order of magnitude greater than exosomes. There are all kinds of exosomes, not just the ones we're using from newborn mesenchymal stem cells. It's how cells communicate. It's basically like if they didn't have internet or phone, they only had FedEx. They're communicating with each other through these exosomes that they're secreting constantly. Question comes up, well, how long is it going to last? And that's a little bit of a tough thing to answer. I liken it to a car wash. How long will a car wash last? Well, of course, if you wash the car and then keep it in a hermetically sealed vault with filtered air, you're going to have a clean car for years, relatively speaking. But if you go around and drive it, then it will be dirty again. As far as the actual physical exosome, they only last probably hours. I think they've done radio labeled tracing, definitely not beyond days, because think of them as like dandelion seeds. They're sticky, or those little Nerf balls. They stick everywhere. So the first cells they encounter are the ones that they're going to bind to and interact with. Having said that, the lasting effects of exosomes are, of course, through expression of mRNA, even more so than the proteins that are contained in there. So the MSCs package proteins, mRNA, which is messenger RNA, which can last for weeks, getting you to produce many, many thousands of copies of that protein. And then microRNA is the most exciting part. MicroRNA is a blocking RNA. It blocks the expression of certain existing mRNA. We do think this is doing a lot of the heavy lifting. There are certain microRNAs that can block dedifferentiation signals, briefly allowing them to act younger and dedifferentiate and be more stem-like and reproducing. Certainly, changes are more permanent in organs that are more permanent, like the brain. After my first nasal injection, I developed the ability to make myself uh, my hair stand on end voluntarily, and that persists after 2 years. I've only done 2 brain injections. I don't actually like to make my brain too fast, but other people enjoy that, and some people with, for example, Bell's palsy or numb feet have gotten lasting benefits. So that's nice to share. Of course, other organs that are undergoing constant re-injury, such as the knees, shoulders, um, these can, reaccrue damage, and so the exosomes will appear to not have lasted as long. But it's like you've driven your BMW all around. Above us, we see that the knee is in a state of constant growth, degeneration, and regrowth. And if you get ahead of the curve, one way that's good. If you get behind the curve, that's bad. So it just depends. When you ask how long they last, it's permanent, but life goes on and rust never sleeps. Here's a summary of my, I guess you could say, 2.5 years of clinical experience. I keep what I think are pretty meticulous records of all the patients, of course, a medical history, a chart note, and a tally. And I have about 158 unique patients. Right, exactly 50% have had repeat sessions, and of the 50% that haven't, I would say about 2/3 would redo it. We've done 731 injection sites. The numbers don't add up perfectly. Sometimes I double counted. If I did a ligament in the ankle, I might have counted that as a ligament and an ankle. Most frequent treatments are IV, nasal, muscles and ligaments, knees and shoulders. We also have done quite a few backs for epidurals, fingers and toes. Sometimes we'll get 20 fingers done. I think the most injections were the lady above, my mom. She has done 19 injections by me. That's 19 sessions. Each session might consist of 2 or 3 injection sites. Just something that differentiates me from other practitioners. I don't tend to charge more for more difficult sites or multiple sites. So you sort of have the luxury of getting multiple procedures on the same day, and you're just paying for the amount of exosomes. Um, I'm next with 12 sessions. Deb up in San Fran has 11. My friend RA has 11. DR has 7. That's Duncan Ross. AM 7 and AF 7. Um, Keep in mind that again, if I do your IV, both knees, shoulder, and nasal, that would be 1, 2, 3, 4, 5, 6 injections. In all fairness, I try to keep good track of the patients. Some are maybe a dozen or so are lost to follow-up, but these are the ones that I would say would, if you called them up, they'd say that didn't work for me, and I would agree. Uh, if you don't see your initials on the list, feel free to email me so I can update that. I would say no significant benefits in about 13%, which is rather low for any procedure, I think. Although, of course, there is no guarantee of results. 4 reasons why people do injections repeatedly. Number 1 is to make gains. RA, like I said, had 11 sessions. He started out with his knees and his elbow. He's a weightlifter and martial artist. But after about the 4th session, he had no more pain, and he just wanted to get ahead of the curve and rebuild the cartilage. The man who squats 1,000 pounds, runs up hills, kicks a heavy bag. So he's gotten 5 more since, just to rebuild the knees and get ahead. A second example of someone trying to get ahead of the curve is my friend Doug Malawicki, who is 82. Here he is running up Mount Baldy, as he is wont to do. And again, he did 1 injection, ran 2,020 miles, and then did another injection, ran 2,000 miles. About 4 months ago, he had knee surgery, partial replacement of his tibial plateau, but he's a firm believer. And if money were no object, I think he would certainly attest to multiple injections and keep on doing that. Second out of four reasons is new injuries. AD is a nice gentleman I've known for many, many years. He fractured his scapula and lost consciousness back in November of 2019 while mountain biking Beaver Creek. And he fractured scapula, but he's having persistent rotator cuff pain. So he came to me, I'm sorry, it was in June, and then he came to me in November. We treated his rotator cuff and it resolved. So then a few months ago, when he had a re-injury of shoulders, he flew out to San Francisco where I was treating patients, and again, he got a repeat treatment. He knew he had that ache in the hole. He flew out, and his shoulders are improved now. So the second reason is people get new injuries. Above me was my previous blog about my ridiculous scooter accident. I ran into that chain at 20 miles an hour. And it did help me recover the intercostal rib injury quite fast. So people get repeat injections because they get injuries. The third reason is they have old problems. They have a checklist. Well, I went to see Dr. Park. My knee is much better. Maybe I'll do something else. And a good example of this would be our friend Kimi in Hawaii, who's 60, and she's gotten probably 7 or 8 treatments. And one of the first times I flew out there to help her, she had whiplash. She had a military neck. It's something I blogged about. And her whiplash resolved, and her brain fog, her inability to find words and to drive safely, resolved pretty much overnight. So she knew that there are old problems that are accruing and still on the list. Just before I left a month ago, we gave her 10 billion IV, and her persistent dental pain, cold tolerance went away, which is nice and indicative of perhaps some regrowth of the tooth. The last reason is some people want to stop aging. Like this beautiful Cadillac, they want to be original, but well maintained. And so RL is a good example of this. I just treated him last week. He had a history of erectile dysfunction. He had a radical prostate surgery in 2017 with a chemical recurrent treated with external beam radiation. And so he had, of course, very severe ED, which he had been treating with prostate injections into the penis. He states that his erectile function did improve after our treatment 2 years ago. At that treatment, we also treated his patella, kneecap, and that pain has since gone away. So he has some persistent plantar difficulty or pain intermittently. That seems to be improved since last week. Last week, we gave him 15 billion. That was 9 billion IV and 6 billion nasal. And he wants to stay young at the age of 74. And he believes that the exosomes did help him. So he's taking that leap of faith to do it. If you're going to do that probably every 2-3 months, 5 to 15 billion, that's a good way to stay ahead. In conclusion, recall and attribution bias are very important. If you think something helped, then you tend to believe it. I think the concept of value is important. You know, we're living in a situation where our bodies are constantly decaying. We have tendinosis, we have arthrosis, which means the tendons and cartilage can't repair. Stem cells are burned out, and for a brief time, if you use the exosomes, they can regenerate. So once a person has the benefits, they believe in it, and they go back and rub the genie's bottle again, and they try something else, or they get a new injury, or they're trying to get ahead of the curve, or they're trying to get gains. Again, an asymmetric risk-reward ratio is there, easy for me to say, and it just means that, oh, I'm going to lose a couple $1,000s, but I have a shot at a really nice permanent benefit, or something that can be repaired in a way that we currently don't have other modalities for.